My name is Katie B., and I'm a prevention consultant with the Iowa Department of Public Health. And joining me this morning is Julie Hibben, who serves as the prevention lead. Just a few housekeeping items. As a reminder, this meeting will be recorded. We ask that all participants mute your microphone when not speaking. Everybody's microphone should be on mute. However, if it is not, we ask that you do so at this time. Also, include all questions in the chat feature. All questions will be addressed at the end of the training. An overview of the Prevention 101 training today is we are going to be providing some high-level prevention concepts. We're going to start the training off today talking about the prevention parable story of the river. We're going to move into prevention history and terminology, as well as prevention models, prevention as a profession, and then we'll spend the last portion of today's webinar addressing questions that you all may have. To start off today, we want to give you context to the field of prevention. We wanted to start this webinar by illustrating a common prevention parable called the story of the river. The story begins as two friends, Susan and Fernando, are fishing on a river when Fernando looks upriver and sees a man in the water. He is struggling to stay afloat. So Fernando drops his fishing pole and pulls the man out of the water. The man is sputtering and cold, and Susan calls an ambulance on her cell phone to take the person to a hospital. Susan and Fernando go back to fishing. Pretty soon they look upriver again and see a woman in the water. She is struggling too. So Fernando drops his fishing pole again and pulls the woman out of the water. She is not in very good shape, so Susan calls another ambulance to take her to a hospital. The friends return to fishing when they look upriver and see a whole group of people in the water. They are struggling to stay afloat and look like they are dragging each other down. Fernando drops his fishing pole and starts hauling people out of the water. He looks up and sees Susan walking away upriver. He calls to her to come help pull these people out of the river, and Susan responds that she is going upriver to find out why all the people are ending up in the water. In prevention, we go upriver to find out what contributes to people misusing substances or experiencing issues related to problem gambling. We want to know exactly what is causing people to fall into this river, which may be different from river to river. Perhaps we go upstream, like Susan, and find a fence built to keep people away from the river has fallen and needs to be rebuilt. Maybe we find a slippery slope running into the river and can plant vegetation on the slope to prevent people from falling down the slope. Maybe we find a big sign announcing, "The water's great, jump in," and we take the sign down and replace it with a warning sign. So we in prevention work find out what is causing people to misuse substances or engage in high-risk gambling activities in our community, and then we work to reduce those risks and to build protection against substance misuse and/or problem gambling.
This is Julie Hibben, and good morning, everyone. So I'm going to just talk to you a little bit about just defining prevention. And so you may have worked only in gambling prevention or substance abuse prevention in the past, and certainly a lot of the approaches that we utilize can be effective really for a variety of topics. So a definition that we really lean on is provided by SAMHSA's Center for Substance Abuse Prevention, or CSAP. And that definition states, prevention approaches focus on helping people develop the knowledge, attitudes, and skills they need to make good choices or change harmful behaviors. And I'm just going to remind folks to please mute their lines. So if you haven't done so, if you're on the phone, if you would mute your phone, or if you would just click the little microphone next to your name in the attendees list, we would appreciate that. So some of the concepts that we're going to be talking about today fall into these specific categories. When we think about prevention, we have a lot to be actually proud of. That prevention has a very long-standing history of growth, and specifically substance abuse prevention. I've worked in the field for 20 years and have had some opportunities to work in a variety of different prevention-related topics, such as child abuse prevention or HIV/AIDS prevention. And truly, substance abuse prevention has a lot of great resources and research and evidence and programs that we can lean on. And like I had mentioned before, regardless of the topic that you address, some of these models and standards that we're going to talk about today can really impact a variety of issues. Prevention also focuses on evidence, research, and science to ensure effectiveness. We really lean on all of those different types of models to make sure that we are doing the best prevention we can possibly provide. So there are specific services that we lean on, there's specific models that we use to really drive the work that we do. And then lastly, prevention is a profession. I think in the past that there's been, and you may have heard this in your own organization, that prevention is something anyone can do. Prevention is just about giving presentations, or prevention is just here to support or promote treatment services. And we know that that's actually not the case. Prevention has a very specific skill set that we'll talk a little bit more about in this training and some additional trainings down the road, that we rely on certification and some core competencies, and that prevention, this field isn't for everyone. We want you to help us relay the message that prevention is a profession, and I'm sure there's many people on this call that have been in the field for numerous years. So we'll talk more about that as well. So I'm going to talk a little bit about some of the history of prevention and some terminology that you may be seeing as we progress through this grant project. So as I mentioned before, prevention has a pretty rich history. Prevention really in some form or another, or specifically substance abuse prevention, has been around for decades. And this is kind of the progression, as you can see on your screen, of the history of prevention. And we've certainly learned a lot. It feels like in the time I've been in prevention, I learned something new all the time about what works. So in the past, we really did lean on scare tactics and war stories. I think all of us can probably remember some maybe from our childhood or things that we've heard about that we saw or heard, and we know actually those concepts don't work. We've also in the past leaned on values clarification, and that's really helping especially young people make decisions about using substances. Nancy Reagan was a huge proponent of just say no, and that was in the 80s, and certainly I think many of us who were younger at that time remember that campaign. But we know that a campaign and just saying no isn't enough. We moved then into a more comprehensive approach, and that really looked at making sure that we addressed prevention through the lifespan, which I think is certainly something we're still leaning on today. And then today, we really look at prevention through a variety of lenses. We are making sure that we lean on data to help drive our prevention services, that we're utilizing evidence-based programs, practices, and policies, that we are looking at the outcomes that we're receiving through our services, and really wanting to make sure that we're continually supporting those programs with the best outcomes possible. So certainly we learned something new. I'm sure in the next 20 years it will be something different, but we have a fast-moving field, an ever-changing field, and we have a rich history to lean on. So another item that I just want to bring to your attention, because I think it's a question that we get asked a lot within the Bureau of Substance Abuse, is what terminology is the department really leaning on when it comes to substance use? And so we're just noting these different types of terms that you may see or you may hear interchangeably throughout your time with us. And we had some discussion as a team, really thinking about what kind of definition we would lean on the most. The challenge is we have language in Iowa code that refers to substance abuse. Our bureau is called the Bureau of Substance Abuse. And some of our federal funders lean on substance misuse prevention. So certainly you're going to see all these different terms. At this point in how things are progressing in our bureau, we feel like it's not probably the appropriate time to lean on one specific type of definition for what substance abuse prevention should be defined as. Just know you're going to see all of these terms used interchangeably. And now Katie, I think, is going to be talking about some of the prevention models.
On this slide, we really want to draw your attention to the public health approach to prevention. So using a disease prevention analogy, the public health model approaches an issue by understanding the interrelationship between the host, which is the person, the agent or vector, which is the substance, and the environment, which is the place, situation, circumstance, or the relationship. So again, looking at that kind of triangle, the agent is the drug or the disease. If you're looking at it again through a public health lens, the host is the person. The environment is context in which it occurs. So it's really important that all three elements are impacted to successfully address the identified issue, being a substance abuse prevention and or problem gambling, to determine the best strategy or strategies to address that concern.
Another component or model that you may have heard about or you will continue to hear about in your time in prevention is resiliency. And so resiliency focuses on strengths or assets that exist within communities or schools or families, and on individual characteristics that buffer against negative health behaviors. So that could be high risk sexual behavior, or it could be substance abuse, problem gambling. And this resiliency research that actually started in the 1950s then led to the theory of risk and protective factors, which you probably heard if you've been around in prevention for any length of time. David Hawkins and Richard Catalano were the developers of that component. And so we'll talk about that next. So Katie's, sorry, we're sharing some notes, so we're going back and forth. So Katie's going to be talking about risk and protective factors.
All right, so risk and protective factors theory says that while risk factors do predict substance abuse, protective factors can buffer risk factors. So risk factors were once thought to play a role in predicting poor outcomes, but research now shows that protective factors are actually more influential and are better predictors. Risk and protective factors are influenced by individual, family, school, and environmental change strategies. And this complements the public health model with focus on decreasing risk and increasing protection within the environment and the host, while also decreasing access to the agent. Here at the department, we often use the term intervening variables.
Right, instead of risk factors. So you may hear those terms used interchangeably.
A last note on the risk and protective factors is prevention agencies are advised to collaborate with area agencies who address shared risk and protective factors. An example of shared risk and protective factors would be mental health, sexual and domestic violence, etc. However, it is noteworthy that IDPH prevention services must have a primary focus on substance misuse and problem gambling. So next we're going to talk about the continuum of care. You will notice some common themes throughout these webinars as they relate to IPN prevention services. And it is important that these themes remain consistent as they are important to the foundation of prevention services in Iowa. So this slide covers both who is providing as well as receiving prevention services in Iowa. So what we want to draw your attention to is the left portion of the continuum of care, which is the universal, selective, and indicated populations. Prevention services utilize the IOM classifications, as already mentioned. Universal services are provided to the general population. Selective are for populations of focus who are more at risk for engaging in substance misuse and or problem gambling. And indicated populations are those who are engaging in substance misuse and or problem gambling behaviors, but this behavior can be reversed with education. It is important to note that early intervention is not a prevention service and will not be funded as such under the IPN project. All right, now we're going to move on to the strategic prevention framework, what again is a core component of prevention services here in Iowa through the department. Historically, a lot of discretionary grants have used the strategic prevention framework, and now the IPN project is also moving in that direction to use the SPIF as a model to drive prevention services. So we have briefly mentioned the strategic prevention framework, but we do want to dig a little deeper into what each step entails and how this process supports and enhances prevention services in Iowa. So again, historically, the SPIF has been used in discretionary grant funds through the department, but the department does support the model and is looking forward to providing assistance to the IPN prevention providers as we integrate this concept into prevention services under this funding stream. So looking at the assessment step, this helps define the problem or issue a project needs to tackle and includes collection of data to understand a population's needs. It reviews the resources that are required and available within the funded service area. And it also identifies the readiness of the community to address prevention needs and service gaps. The next step focuses on building capacity, and this is the step to mobilize human, organizational, and financial resources to meet project goals. Training and education to promote readiness is also a critical component of the capacity step. Going into planning, the plan step involves creation of a comprehensive plan with goals, objectives, and strategies to meet the prevention needs of the community. Organizations select logic models and evidence-based programs and policies and determine costs and resources needed for effective implementation. So the implementation step focuses on carrying out the prevention plan and identifying and overcoming potential barriers. During implementation, organizations detail the evidence-based programs and policies to be undertaken, develop specific timelines, and decide on ongoing program evaluation needs. Moving into the evaluation step, this helps organizations recognize what they have done well and what areas need improvement. Evaluation measures the impact of programs and practices to understand their effectiveness and any need for change. Evaluation influences future planning and can impact sustainability because evaluation can show sponsors that resources are being used wisely. So within the strategic prevention framework, there are two guiding principles at the core, which are sustainability and cultural competency. So cultural competence is the process of communicating with audiences from diverse geographic, ethnic, racial, cultural, economic, social, and linguistic backgrounds. Becoming culturally competent requires cultural knowledge and skill development at all service levels, including policymaking, administration, and practice. Sustainability is the process through which a prevention system becomes a norm and is integrated into ongoing operations. Sustainability ensures prevention processes are established, partnerships are strengthened, positive prevention outcomes are maintained, and financial and other resources are secured over the long term. So additional resources regarding the SPIF will be provided soon.
I'm going to talk a little bit about how we provide prevention services in the best way possible. I touched on this at the beginning of our time together today, but we really want everyone to focus in on these specific areas. Making sure that your services are data-driven. And I think, and I can say this from my own experiences, that oftentimes in prevention, we provide the same services because the schools like them, or we've received training on a specific type of program, or the community really likes a specific program, or the coalition that we're working with does. Instead of really looking every year or on an ongoing basis, looking at our data to find out what the true needs in our service area are, and then selecting the best programs possible to address those specific issues. So that's certainly one important component, and we'll be giving you more resources on how best to do that. Another component is outcomes-based prevention. And so when we're thinking about prevention efforts, we want to, one, engage the community in deciding what services that we need to be providing. I think in the past, what sometimes happens is that we're working under a grant, or we have very specific time limitations, and so we get together as a prevention team, or the prevention services supervisor decides what services are going to be provided, and that's how that occurs. When we're thinking about really engaging the community, there's a thoughtful process for getting input, reviewing the data, and then coming up with a plan. And the strategic prevention framework can certainly help with that. Another piece is making sure that we're looking at the results of our programs. And so if we have a program that's not, we've collected some data on either pre-post survey evaluation or through our IDPH prevention survey that we're going to be providing you with more details on soon. If we're looking at the results and we're seeing that the outcomes aren't that positive, is that a program we want to continue with? Or is it due to a variety of factors? But we still want agencies to be looking at that information. It's really important to either decide maybe there's something that we're doing with implementation that's not working, or maybe it's not the best setting, or is it truly the program is not the best fit? So we'll be talking more about that with you actually tomorrow, and then in some upcoming trainings. Another component that you're going to hear a lot about as we move ahead is really utilizing evidence-based programs, practices, and policies. And the reason for that is, one, our funders want us to be using programs that we know work. And that means programs that have had evaluation and research conducted. There's some very specific definitions that we look at when we are identifying evidence-based programs, practices, policies. So, you know, the times of creating programs and not knowing if they're effective are really have gone away. Even if you've created a program within your own organization, we're going to be asking you for evaluation results. There's going to be a very specific process that we're going to ask you to go through with our evidence-based practice work group. So just know that that is going to be a shift in how we do the work in prevention, not only through this grant, but across the board at IDPH when it comes to prevention grants. But all these components are making sure that we provide the best services possible for islands, which really is the true goal. Another piece that I just want to touch on briefly is I think for block grant agencies that have received this funding in the past, it's very challenging to hone in or make sure that you're focusing in on services that are listed in your work plan. And oftentimes you may have community members that contact you that want you to do some kind of programming that's outside the scope of this project. And we want you to be thinking about services that are listed in your work plan If you have other issues that come up within your service area during the project period, we will work with you on updating your work plan. If you're seeing increases in a specific substance and there's a lot of community concerns, we will work with you on that. But you need to be in touch with us because we want you to be focusing in on services that we have approved. And if you are getting requests from community members for services that are outside of the scope of that work plan, then we really want you to be thinking about other funding streams that you can tap into to provide those services. There is a scope to what this grant can provide, and truly it can't do all things for all people. There's not enough time, resources, and people to do that.
All right, so now we're going to focus on prevention delivery. So prevention services funded through the IPN project must take place within each county of the service area and serve Iowans across the lifespan. In addition, prevention services must take place throughout the year and not predominantly during the school year. It is important that each county within the funded service area receives adequate prevention services. Contractors should take into consideration each county and their population when planning for prevention services. It is not enough to host prevention services within the county seat or other largely populated area and invite the county to attend. In prevention, we know there are barriers to consider when providing prevention services in the rural setting. And some of these examples would be transportation, childcare, income, weather, employment, etc. In order to provide prevention services that best fit the needs of your communities, we ask that you engage stakeholders in these conversations to ensure services are a good fit. So historically, prevention services have largely focused on the youth population. Prevention services provided through the IPN need to be delivered to Iowans across the lifespan. We recognize this is an area of growth, and the department will be providing additional guidance and support as we develop in this area. The department will be reviewing prevention work plans to make sure that services are balanced and meet this requirement. Lastly, prevention services must be provided to Iowans throughout the entire 12-month contract year. Services cannot be predominantly provided during the school year when evidence-based programming is occurring. Both education and environmental strategies are a focus of the grant, with the expectation that all Center for Substance Abuse, the CSAP 6 strategies, are utilized within the work plan. Again, while education strategies such as life skills are often provided during the school year, environmental strategies are worked on throughout the year. We also wanted to touch on engaging sectors within substance abuse prevention as well as problem gambling prevention work. So as Julie has mentioned throughout today's webinar, data is a vital component to identifying appropriate prevention services. So we want to make sure that agencies are assessing local data. Again, that's reflective of the lifespan, and that's truly to gain a better understanding of the impact the priority areas have in the awarded service area. So in order to focus on that second step of the strategic prevention framework, which is focusing on capacity building, we are encouraging individuals to use the drug-free communities identified 12 sectors, which are listed on the screen in front of you. It is important that agencies work to ensure a diverse group of stakeholders are engaged in the process when identifying, again, both substance abuse and problem gambling prevention efforts. So this is a continuing process throughout the life of prevention services. And we really encourage you all to assure that as many sectors are involved in the planning and identifying prevention services within your awarded service area to ensure that the appropriate service is a good fit for the population being served.
Okay, then I'm going to be talking just a little bit about prevention as a profession. So as I mentioned before, prevention does take a specific skill set. There are core competencies we use, there are models, evidence, research science, and not everyone can just walk into prevention and be successful. And so certainly we're going to be working with your agencies to make sure you have systems in place to help staff coming on board to make sure they feel supported. We're going to be offering you trainings, and there's a variety of components that we're going to be looking at to make sure that you are successful as a prevention specialist. So one component that IDPH is wanting to ensure everyone has if they're providing prevention services through the IPN grant, but then this is something that we're seeing across the board with our discretionary grants as well, is making sure that everyone is certified. And we feel like that is a really important component because it lends credibility to the field. So regardless if you've been in the field for a number of years or if you're new, it provides everybody with a set standard. There are standards on the treatment side for staff that are providing treatment services. We feel like that needs to be the case for also prevention specialists. I think also, in addition to that, it helps people understand that this is a profession, that not everybody can just walk into it and do it successfully or effectively. So just, we've talked about this, I think, in the previous webinar, but just to remind everyone that within this specific funding stream, that the expectation is that within 18 months of hire or from 18 months at the start of the project, that the staff who are leading prevention efforts and that are providing prevention direct service will be certified. And so where the expectation is that you will meet the certification process requirements, be certified or mentored by a certified prevention specialist, attend substance abuse prevention skills training, and then attend prevention ethics training for certification. So those are the components. And then there's some other, I think, additional training components as well. So prevention supervisors and leads do have a different time frame. And so you can see that on your screen. All the information about certification can be downloaded through the Iowa Board of Certification. And that web link or website is listed on your screen. So lots of details. There's a whole guide that will walk you through the process if you're not familiar, but lots of really good information. So please be keeping that on your radar. IDPH will be monitoring that and asking for documentation of certification at the start of the project, which we've done already. And then once your staff members or you as a staff member become certified, we will want that documentation as well. Another component to be considering, and I think this is something we probably don't talk about enough, is making sure that everyone understands that there are specific prevention ethics expectations for us providing prevention services. So if you've not taken a look at those, actually you can either go to the Iowa Board of Certification website, and there is a listing of those, the Code of Ethics for Prevention. You can also Google Prevention Think Tank Code of Ethics, but our services should be guided through 6 principles. And those are listed on your screen: non-discrimination, competency, integrity, nature of services, confidentiality, and ethical obligations for community and society. So please, we will be providing you with more trainings on those, but please, if you haven't taken a look, we'd encourage you to do so, be very familiar with those Code of Ethics. They should be driving the work that we do in our field.
All right, we wanted to take some time today to talk about, again, prevention as a workforce, which really leads into looking at prevention as a profession and a career. So the department has established a workforce development task force to help support and define prevention in Iowa. So this task force will address the following by focusing on 4 strategies, which include defining needs, identify gaps, and craft a plan to address subject matter training for all experience levels of prevention professionals. The second strategy is to diversify the field of prevention professionals to reflect the population of Iowa through recruitment and retention strategies. The third goal is to identify an onboarding model for prevention professionals by 2020 to ensure basic competencies are met across all IDPH recognized primary prevention strategies. And lastly, look to foster and encourage partnerships between prevention professionals and community stakeholders across the state to ensure consistent practices are applied. So embedded within each of these strategies are action steps to complete, which will help achieve the desired goals. And the department will be providing additional information about this workforce development task force. And this is a component of the 5-year prevention strategic plan that was developed two years ago about. So it's just, I think, important to have that conversation that here at the department, we're looking at workforce as a really vital component of prevention services in the state. We want to reinforce prevention as a profession and work with you all to help establish what that foundation looks like. Again, so that Iowans are receiving the best prevention service possible, and there's a clear expectation and set standard on what it takes to be a professional in this field. So a common question the department receives is where to obtain credible information specific to substance abuse prevention and problem gambling. So whether you began your career in the field of prevention recently or have been in the field for several years, the community views you as the expert. So it is important to use credible sources and data when providing prevention services. So there are several online options available to increase your knowledge on current substance abuse and problem gambling information. The list provided can be used or shared with prevention specialists to learn more about these topics. I want to note that this is not an exhaustive list, but it is a good starting point for individuals in the field to start identifying, again, those credible federal websites and links. It is important to note the usage of pop culture in prevention. And while it is beneficial to know the current trends and topics that may be receiving media attention at the national level and beyond, it is the expectation that prevention efforts focus on the grant-identified prevention priority areas and subsequent work plans. Finding a balance between knowing what current trends are being discussed and supporting your work with credible information, it's a balancing act. It's important, and we definitely understand the benefits of understanding both. We really would advocate that if you are in your community and hearing a lot of pop culture references, that you are equipped with the credible sources and data to support those conversations that are taking place.
I'm going to just talk for a minute about some of our state resources. And as Katie mentioned, this is not an exhaustive list. These are partners that we are working with on our advisory council currently. And these are folks that you may not always think of when it comes to prevention. But for example, the Alcoholic Beverages Division certainly they have a small education department and can provide you with a variety of data related to alcohol sales. So even though we're a fairly small field in our state, there are a lot of statewide organizations that are a part of the prevention process. So we'd encourage you to take a look at all of these resources if you're not familiar with them. I will also note that the PROSPER process is a part of Iowa State University, and Dr. Dick Spoth is a huge champion of prevention efforts. He's a prevention scientist and researcher, and if you do any research about strengthening families or some other prevention programs, you may see his name pop up. We are working to do some partnerships with him regarding some trainings and some work that they're doing through PROSPER right now. PROSPER is a specific model, and I'd encourage you to take a look at it. It actually is similar to some of the models we've used in our discretionary grants, but that group is certainly someone you want to partner with if you have not gotten the opportunity to do so, and they work through ISU extension offices around the state. I will also note that Your Life Iowa is a resource that we are utilizing for gambling, and there's a variety of information about substances on that website as well. We're in the process right now of creating a prevention resource section of Your Life Iowa that will be very general. So you don't have to be a contractor of IDPH to tap into those resources. They will just be some very overarching guides, information, listing of websites. So if you're new to the prevention field, that would be a good resource for you to tap into. We'll share that link once it's available. I think it's getting very close. We're also going to be creating a training calendar so then you all can be in the loop about some of the broader trainings that we're going to be providing, and including things like SAPS, the Substance Abuse Prevention Skills Training, Prevention Ethics. So more information will be coming, but that Your Life Iowa website is a great resource for you to utilize. I also want to talk to you just briefly about data resources, and this is another question that we get asked a lot about, and hopefully you're familiar with some of these already. These are more state and national resources, and there may be some additional data resources that you have that are accessible within your service area. But these are just a few that we want to draw your attention to. Once again, not an exhaustive list. There are a couple on here that I didn't include, but certainly there, if you Google substance abuse prevention data resources, I think SAMHSA has a pretty exhaustive list on their website of treatment and prevention data resources that you can look at. So the Behavioral Risk Factor Surveillance System, or we call it BRFIS for short, is a part of the CDC, and it's a state-based survey that collects data with adults, and I think there is a youth behavioral risk survey as well. That's a component of that. So the results are available at the national and state levels and some local levels. I don't believe we have local level data in Iowa because the survey sample is pretty small, but it is a good resource. So you can certainly just Google BRFIS and more information will be available. The IDPH data portal, I just want to draw your attention to it. We are in the process of sunsetting. We had an Iowa epidemiological website and had some challenges with trying to keep it updated and relevant for folks. It was something we created with one of our discretionary grants on the prevention side about 10 years ago. And what we've decided to do is start utilizing the IDPH data portal. And if you didn't know about it, we do have one. And there's a lot of public health data that's accessible, I believe, at the state and county levels. So it's going to take us a couple of years to actually transition all the data from the EPI website into the IDPH data portal, but then it will be a one-stop shop for really any substance use data in the state. So we will be giving you updates on that as the project progresses. It's pretty labor intensive to do all of that work. And there's many of us who have been involved. We've been having discussions for over a year now, and we're just now starting the process. Another resource that I want to make you aware of, if you're not already aware of, is the IDPH epidemiological profile. And I think I mentioned it on one of our earlier calls, but this profile gives an overview of substance use in our state. And we publish this through our division every 2 years. So it will really give you an idea of trends that are happening and really help you understand what's going on with substances in our state right now. So our next EPI profile release actually should be happening fairly soon, I think in the next month or so. When it's available, we'll let you know, but that would be a really good resource for you to take a look at. We also have some data briefs that our Bureau puts out every couple months. I think we recently had one on overdose deaths and methamphetamine use. So if you go to the State Epidemiological Work Group web page that's on our Bureau of Substance Abuse website, you'll be able to find all of those data briefs. Hopefully we'll find a better location for those because our IDPH website is a little challenging to navigate. We're well aware of that, but those resources are available for you to use. We also have the IWU survey, which happens every 2 years. We're so fortunate in our state to have that. And we'll be talking to you more about that as the results come in from the last survey. The survey was conducted this past fall. And we certainly appreciate those of you who are working with your school districts to make sure that they're participating. We really do appreciate the efforts that you put into that. The Monitoring the Future survey is a national survey that looks at behaviors, attitudes, and values of young people. And it's just interesting information. So just Google that if you're just wanting to know some more details. And then NISTA, or the National Survey of Drug Use and Health, is a survey that looks at prevalence, patterns, and consequences of alcohol, tobacco, and illegal drug use and misuse, as well as mental disorders in the US with people ages 12 and older. So, and this survey generates information at the national, state, and sub-state levels. So those are just a few resources that you can tap into if you're interested. Also wanted to share with you a couple of training resources, because this information I know is for some has been a little bit hard to find. I'm hoping once we have a training calendar up and running, we will be able to streamline the training opportunities that we have available through our bureau. But we at the department collaborate with the Midwest Counter Drug Training Center. We like to call them MCTC for short. And they are out at Camp Dodge in Johnston. They have been a wonderful partner to provide lots of great trainings for many, many years. They are the ones that we partner with to provide those 2 foundational trainings that everyone needs for certification. So the substance abuse prevention skills training and then prevention ethics training. Typically in the past, we've tried to offer 1 ethics training for certification a year, and then 2 SAPS trainings per year as well. With some of the new expectations with the IPN project, we are going to be working with MCTC to increase those training opportunities. It's a little challenging because MCTC has a yearly budget process, and there are points in the year that they are not permitted to plan because they're waiting to see if their budgets are approved. So it's kind of hard to do planning past a year at a time. So just know we're working with them as quickly as possible. We're trying to get a training calendar set up for you so you can plan effectively and plan ahead if you have new staff, those of you who are supervisors, if you have new staff coming on board to this project. So more information is coming. But if you go to the MCTC website, just Google Midwest Counter Drug Training Center, you'll be able to find all the information about these trainings. There are a couple coming up, and you can register for the trainings there. Also, just to let you know that these trainings are free, and we're fortunate in Iowa that we can offer these trainings for free. Not all states do, and it's because we have the support of MCTC to do that. Yes, you still have to pay for your time for staff to come and your meals and travel, but you don't have to pay a registration fee, which is something we're happy to offer. We also are providing a monthly prevention webinar series, and it's happening the first Friday of each month from 1 to 2:30. And we are in the process of scheduling or kind of making the registration links for the next probably 6 months of trainings available soon. So we'll be sharing that with you if you're interested in attending. And we try with those webinars to make them broad. So it's not a grant specific training. It's really about topics that impact the whole prevention field. You do not have to be an IDPH contractor to participate in these trainings. We're opening it up to anyone who's interested. So please know you can share those with your partners or your coalition members. We're happy to engage anyone who wants to participate. I will also say that we've at the department have had some challenges with our resources available for trainings being unavailable. And as you know, if you've been in the field for a little while, we did have access to some training and TA services through SAMHSA up until this past year. And SAMHSA has decided to go in a different direction with training and technical assistance. The CAPT was a great resource we utilized, and another TA group called JBS. And both of those contracts ended the end of September. So we have had to do a lot of work behind the scenes to figure out how we're going to support a training infrastructure with very little resources and very few staff. So we appreciate your patience with us as we are figuring out some of those next steps. There's a lot of work going on behind the scenes to figure out what we can do. SAMHSA has provided or has funded some group called the Prevention Technology Transfer Centers, or PTTCs, and those contracts started in October, but we have not heard what the next steps are with that group. And our PTTC is located in Missouri. So once we have more information about how that group is going to be structured and the resources they can provide to all of you, we'll be sharing that, but the details are not clear yet.
All right, so next we're going to discuss, prevention guidance. So iowgrants.gov is the site used to communicate all grant-related items. And this includes, but is not limited to, key personnel, subcontract information, work plans, budgets, contract documents, and communications specific to the grant. iowgrants.gov must be used by all IPN-funded contractors. And again, we do encourage general questions to be directed to the IPN help desk at ipn@idph.iowa.gov. So all IDPH communication regarding the IPN project will be directed to the contract holder, and then again via the correspondence section of Iowa Grants. It is the responsibility of the contract holder to communicate these messages to agencies who are subcontracted to provide prevention services. And we know that that may be a slight shift in thinking because of this new IPN project. So there may be some subcontracted agencies who historically have held the contract for those services, but we really want to assure that there's clear communication, that through the department, all communication goes through the contract holder, and then the contract holder is then responsible for communicating that message to the subcontractor, and vice versa. The subcontractor needs to communicate through the contract holder any questions that they have related to the project. So if you have any questions specific to communication for subcontracted services, again, please direct those questions to the IPN help desk, and we'd be happy to provide further clarification. Reporting of prevention services must be clearly and accurately documented in contractor records, and must be clearly and accurately documented and reported in the grant tracking system and department data systems. So the department requires periodic reporting of compliance with proposed work plans, provision of services, and incurred expenses by the contractors. However, do know that there will be additional details coming soon specific to prevention reporting. So talking about data collection, a contractor must document provision of prevention services in a manner sufficient to support contractor billing and reporting and department monitoring. Contractors shall specifically document use of the Institute of Medicine classifications, the Strategic Prevention Framework steps, and the SAMHSA Prevention Services categories, or the CSAP 6 strategies. The department has a system in place for collection of data, and a contractor shall report certain prevention service information and data through these department-approved systems. These include iSmart, which is the Iowa Service Management and Reporting Tool, which is substance abuse and problem gambling prevention data, and then also Qualtrics, which is the substance abuse and problem gambling prevention outcome data for evidence-based programming. So that is the portal that we use for evidence-based programming, where there is a pre and a post-survey instrument utilized. So again, we also know that these are two systems that are currently being enhanced for this current project. So further information will be shared soon regarding data entry and collection. So as a condition of the contract, The contractors shall assure linkages with the local Board of Health in each county where services are being provided. And we strongly want to have the conversation that this is more than just reporting out prevention services that are taking place, but having that strong collaboration with your local boards of health so they can help guide, inform decisions related to prevention services within those counties. And just, again, fostering that relationship and assuring strong linkages with your county boards of health, and encouraging agencies to, again, maintain that documentation of that communication, that collaboration that they're having with those local entities within their service areas. So at this point in time, this concludes the Prevention 101 webinar.